And we are. If I'm not talking to myself, this isn't happening, right? Right. Okay, so if everybody wouldn't mind putting their name and affiliation in the chat, we would love that so we can see who's here. And then just to make sure that Shelly has all the time she would like, I'll go ahead and get started. So welcome to today's Health Council Talk. We are joined by Healthy Climate New Mexico and Shelly Manlev, who is the Executive Director. She has great information for us today. Anytime that remains at the end, we'll share some additional updates with you. So we'll go ahead and start with our land acknowledgement. The New Mexico Alliance of Health Councils humbly recognizes and acknowledges we are on unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, Apache nations, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities while strengthening and respecting relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nation sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes, pueblos, and nations who are still here today. Again, thank you so much, everybody, for joining us. Just a few notes before we get started. The statewide annual Health Council meeting has launched. It is ready for you to join us. We're also have an open sign-up form for any health councils who would like to present at the annual meeting, about the great work that you're doing, successes that you've had. So the deadline is coming up in 7 days, December 27th. And we have the sign-up link here, but I'll also drop it in the chat in a second. And then please do register for the statewide meeting. The deadline is January 3rd. That way, you'll have to get t-shirts ordered, give final head counts, all of that. It's on our website, but I'll drop that in the chat as well for you. So I will stop sharing and I will pass it over to Shelly.
Wonderful. Thank you so much. Enrique, where's our breathing exercise? I remember how you, would you be willing to lead a breathing exercise?
I can do that.
Thank you.
Let me get it up. And it's been coming out quiet lately, so please, somebody tell me if you don't hear it. Go ahead and exhale.
Inhale. Hold. Exhale. Hold. 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 Finished.
Thank you so much, truly. And thank you all so much for being here on this day before the weekend, before the, right? hopefully a holiday time that we will have some good rest in, because when we return from the holidays, the work is big and large, and we will all need all the resources, love, self-compassion, care for others, and cohesiveness, community that I know Val calls upon all of us so many times. Good afternoon. I'm Shelley Mann-Lev. I use the pronoun she, her. I am here in Santa Fe. And I am here in my role as the Executive Director of Healthy Climate New Mexico. But most importantly, I'm here as somebody who's really dedicated my life and career to public health in New Mexico. Somebody else was saying they've been in New Mexico half their life. I'm a newcomer. I've been here half my life. I arrived in 1993 and gave birth to my beautiful daughter, whose picture is there, who's just became a physician assistant, actually. Very proud of her. Raised her here, and this is my home that I love. And we're going to be talking about a place that we are all in that I think is takes a lot of heart, mind, and hand capacity, which is about climate change. And our organization, Healthy Climate New Mexico, of which a number of you are members, I hope you will all consider becoming a member. It's free. And as you know, with health councils, the more strength there is in coalition in numbers, right? It matters that there are, I believe, now 43 health councils, including 9 tribal health councils and other counties, that together we just do so much more. So the focus of today's session is going to be preparing us for what can be done around climate and health in the upcoming legislative session. I know and I strongly support and want to see the health councils thrive, and to do that we need to have good legislative action this year, and you have incredible leadership to do that. And we also need to make significant progress around climate and health. And so I'm going to be talking about the kind of 2 buckets, if you will, of climate and health. I'm not going to go into and not going to do a presentation on climate change in New Mexico. I do that, and I'll actually share out a link. We just did, I think, a really beautiful webinar Healthy Climate New Mexico did that was shared out nationally, with the leader of the organization that we are part of nationally, called the Medical Society Consortium on Climate and Health, Dr. Lisa Patel, who's a physician at Stanford, who is dedicating herself. She's a pediatric hospitalist, and we all have stories, and this has become my dedication first and foremost because I have to say I would do anything as a mom for my daughter. And I looked at myself in the mirror and said, what's the most important thing I can do? And that it is to, in fact, address climate change. Lancet has called it the greatest threat to public health that we face in our century. I'm not into comparative threats. I know there are so many. I have dealt with many preventable public health problems like tobacco, like alcohol, like childhood injuries that are preventable when we didn't used to have everyone in a car seat, opioid issues, violence. This is a preventable public health problem. And I hope that through our work, joining forces with so many other folks who've been doing this work for decades, that in fact, we will be, in our time, we will make the decisions. We will support our decision makers, our lawmakers, to make the decisions that will eliminate carbon emissions to zero in a short period of time, and support our communities as we adapt. Because no matter what we do in terms of eliminating emissions, no matter how quickly we reduce those carbon emissions, our communities today, yesterday, tomorrow are suffering from effects related to climate change. Before I dive into the specific legislation, I'm going to put a link to and show you a day at the Roundhouse that we are hosting that I would love to have a number of you participate in. We actually just have 8 spaces left. We have room for 50 people. It is Climate and Health Day at the Roundhouse. And the goal is to let your climate story and voice be heard. We are going to gather all day. The morning will be an educational, process on climate and health and the policies that are being considered. The afternoon, we will, in teams of 4, be going to visit with legislators. I know that many of you have a lot of experience with that now, and it would be really wonderful if we had a number of folks from health councils who work with health councils who joined that day, in addition to Public Health Day, which we're going to be at. We're so glad. Thank you all. I'll have a chance to be part of the press conference and also be exhibiting. But really, really hope that you can download that flyer. I'll also put a link to the registration in the chat. Are any of you here planning? I know Val, you signed up. We've got about 42 people so far joining us. Anybody else available that day? We do have funding. We just received a grant from an environmental foundation that will allow us to pay for travel and a night's lodging. So that's a big deal for us. We're mostly volunteer with a little bit of administrative support. But any of you think you might be able to join us that day? Would love, especially I'm going to say some folks from the Chica projects or from the parts of the state who are most impacted by these climate change issues with oil and gas extraction. So please, please consider joining us and signing up. Yeah, I think Valerie and Valeria and I think Enrique, I know Janice from your team are part of that. Monica and Jeanette from Chica are planning on being there as well, so it would be great.
Absolutely. We stand with you.
Well, we stand together for the health of our communities, right? So, yeah. So this is going to be, this is unlike what I usually do. I usually have a PowerPoint and go through everything. I'd like this actually to be much more interactive and give you an opportunity to really, like I said, to ask questions, to share. Thank you for the update, Holly. We now have 10 tribal health councils. I love it. And that's really, very important part of the work we do. So I'm going to start with the adaptation and resilience bills. There are 2 key adaptation and resilience bills that are going to be proposals that we're going to be working on this session. This is the core group. These are the partners that are working on these 2 proposals. And I have to say, you can see right there in the middle is the New Mexico Alliance for Health Councils. We're thrilled that, you all are part of that partnership. Also the Health Equity Council. If there is another tribal or county health council that wants to be part of this core group, after you hear about this, we are interested in that. But most importantly, at this stage, we're looking for organizations to sign on. In past, these proposals have been brought forward for 2 years. This is the 3rd year. We hope the 3rd is a charm. But I just want you to see the groups that are leading this effort, right? Albuquerque Healthcare for the Homeless. Why would they be involved with adaptation and resilience? I mean, it's because our unhoused folks are at greatest risk, particularly of extreme heat, but they suffer from everything. They suffer from drought. They suffer from flooding. I mean, I can't even imagine. So Albuquerque Healthcare for the Homeless, American Lung Association, focusing on the air quality. I just learned something today that I did not know, which was kind of stunning to me, and that is the number one, what do you think the number one diagnosis for children's medical services, right? That's our high needs, our program to serve children with the greatest number of medical needs in the state. The most common diagnosis. Anybody want to guess? Kind of blew my mind. Somebody guessing in the chat? That's right, Holly. Holly, and you guys got it. I did not know that. And I just need to tell you, it's asthma. Thank you. I'm curious, Holly, Holly and Eugenia, is it Eugenia? What made you guess that?
Uh, Previously, Shelley, I was working at the Texas Commission on Environmental Quality. And so I had a group that was working on air quality issues. And so that's why.
So you know how common childhood asthma is and how devastating.
It is.
Wow. So you did it in Texas, but now what is your role now?
Now, right now, I'm working at the Health and Human Services Department here in Doña Ana County. And so right now I'm doing community coordinator for different committees that I'm working with.
Including the Wellness Council, the Health Council in
Right.
Doña Ana County.
Mhm.
That's awesome. Thank you for being here. And Holly, do you want to add anything in terms of asthma in kids? What made you yeah.
I don't remember exactly where I read it, but I just remember reading about the relationship between poor air quality and asthma in children, and then that was making the connection between the air quality being much worse in neighborhoods that have lower incomes, and so it was just an article highlighting how prevalent asthma was, especially in communities that were already at higher risk because of things like poor air quality and a number of other factors. So it was a lucky guess. I didn't have as much experience as Eugenia in remembering where, but yeah,
Wow.
stuck with me.
Wow. And Margaret, you've got personal experience. Do you mind sharing a little bit about that? Wow.
Yes. My son was very healthy, up to the age of 1. Right after his first birthday, that's when things started falling apart. He'd get sick super fast. Loss of breath. I could actually see his stomach going in and out, just trying to gasp for air. And unbeknownst to me, I didn't realize that they don't diagnose under the age of 5. They will seek out every option they can, but he was seen so many times in the hospital. I believe we were in the hospital 3 times in 15 months span. And so they diagnosed him at 2.5 years. So he has been on asthma medication since then. Nighttime medicine, so he does not have an asthma attack at night, because that's when they usually have asthma attacks, is at night when their body is resting. Again, that was news to me.
Wow.
They would give him Montelukast at night, and now that he's 8 now, but now he has to take albuterol right before he plays. So he has to go to the nurse's office at school every time they have PE and recess to take his emergency inhaler.
Wow.
So that's where we're at.
It is first of all, I'm sorry, and I'm glad you're getting good care and that he was diagnosed, because, I mean, having your child struggle with breathing has to be one of the most frightening experiences for a parent. Our board chair, Dr. Paul Charlton, he's the chair of Healthy Climate New Mexico, one of the co-founders with me and several other wonderful people. He lives in Gallup. No history, I don't know if your family has any history of asthma. He has 2 children, and his youngest son, when he was like 9 months old. So Paul runs the emergency medical center at Gallup Indian Medical Center, and he had to bring his son for emergency treatment multiple times to the hospital. And his son is diagnosed with asthma as well. He's 4 years old now. So it is, asthma is increasing in intensity. And I'm sharing this because, again, the American Lung Association, obviously it's a major concern, but a very significant driver of the increase in asthma that we are seeing in children has to do with air pollution and air quality, and climate change is a major contributor to that. Margaret? Yeah.
One thing I just want to add as well, rain. After it rains, that has been happening where he has more asthma attacks after it rains. So whatever whatever the rain is falling on and pushing out into our lungs, is alarming. It's very,
Wow.
very alarming.
Well, wow, it is alarming. And, again, we're talking about climate change, record breaking every year, right? This year we actually hit as a world, you all hear 1.5 degrees centigrade, right? Not that any of us know centigrade means, because it's really this year as a world, it doesn't mean we've crossed the threshold because they say it has to happen for 5 years, but we actually hit that 1.5 degree threshold. It is every year getting hotter and hotter. Every summer we break records. And of course, it's not just the heat, it's the severe storms because the storms are different. I don't know if there's anybody here from Ruidoso, but from Roswell, but my gosh, I mean, the storms are different, everything's different, and that's our new reality. So these two proposals, which have to do with adaptation and resilience, because again, we've got to do that now, need to also be integrated into a larger conversation. So right before this call, I was in a call with the 3 center directors at DOH. DOH now has centers. Oh my gosh, I can't track it all. But they have the Center for Health Protection, they have the Center for Access and Linkages to Care, and they have the Center for, oh gosh, the one that has NUPAC and CMS and all those in it that Janice Gonzalez is leading. I think it's like community health programs or something like that. Anyway, we've been meeting regularly since August, talking about climate change and health and extreme weather and health and what are we going to do, because the Department of Health currently has 0.2, that means 8 hours a week, of an incredible epidemiologist, Chelsea Langer. That's it, 0.2 FTE focused on climate issues, even though we have huge health impacts happening. And I'm going to say, I had absolutely no training in my MPH program. I know it was a few years ago, but in my MPH program, I had 0 training. I'm curious if anybody in any of your, whatever you did for schooling, anybody, raise your hand if you had any training around climate and health issues. Did anybody on this call? I'm looking. Val, you did. Tell me what kind of training you had.
Yeah, so in my 30-year career working with the nonprofit sector, I worked with the Bioneers organization from 2008 and then became their COO in 2015 through 2020. And by the expression in your face, Shelley, they focus on social and environmental justice and health and the impact of climate on health. They've been ringing that red alert since the 90s, my friends, in New Mexico, in the Bay Area, nationwide. And so, very much. And as a health educator myself, integrative nutritionist, that's definitely been part of the conversation in my private practice, and advocating. So being involved with the, is it called New Energy?
Economy.
Thank you. Yeah, I did advocacy work for them back in 20 something. I can't remember right now. I've been involved with them on and off for years. So very much, everything, we're interconnected, our health, the environment, nature, soil, air, waterways, they are the tissue, the blood in us, the air in our lungs. It's all interconnected, my dear friends. And I know we're preaching to the choir here, but yeah, that's my sort of quote unquote education, hands-on experience, Shelley.
Well, that's awesome that you have that background, because we are in this time of change, of understanding, just as we started with chronic disease. Those of you who've heard me say that, then we expanded to understanding social determinants of health. We now understand that social determinants of health include environmental conditions, including climate and other environmental conditions. And those probably, just like social conditions, we were like, oh my God, the impacts they have have even more impacts than any of us could ever have dreamed of. Well, Eugenia, you want to add something? That'd be great.
Yes, when I was working at the commission, we had um, a network with, we were networking with oh my goodness, with the students at Texas Tech here in El Paso. And one of the classes was required to be environmental topics. And so we were exposing to them what the commission did, regulating permits. We were working with the border, how we are connected, like Valerie was saying, different. My thing was that environmental education and environmental health go hand in hand with all the topics on air, water, waste, emergency response, all that, and how it affects health. And now I see more people being affected by mental health because of the floods and all the climate changes, fires, and all these other hurricanes, different things that are affecting us. And so it's so important to see, and I was glad to see that they were integrating one of the classes to be, and we were visiting with them and yes, exposing them to that. So maybe now people, or maybe we can advocate for that in the legislature.
Yes,
Session that, education should be part of that.
absolutely. And I'm so glad you had that experience. Actually, we have 2 work groups with Healthy Climate New Mexico, and our education work group, has 2 teams. One is the Heat Summit and other educational offerings. We are doing the Heat Summit on April 23rd, half day. It's going to be great again. I know I learned so much. But the other team that's part of our education work group is we are working on increasing the number of offerings in training programs, right, and in schools, but higher education on environmental health and climate change, because we've got to start training people. And we're starting with studying what's currently being done. So we're looking, always, as we know as good health educators, you start with strengths and assets and then build from there. So we're doing that. The other thing that just struck me as you're saying is I know many of us are familiar with ACEs, right? Adverse childhood effects. And when you think about those, none of those refer to experiencing the loss of your house through fire. None of them mention, the environmental trauma that so many people are experiencing, whether it's, again, extreme heat, or it's the kind of disasters, wildfire, flood, that
or not even having water in your
yes,
environment, because we live in a desert. And
So-
how
so
is
we-
that affecting us? Yes, I'm sorry.
no, thank you. I'm sorry for interrupting you. I look forward to reaching out and connecting more, because having the background you have, it will be so valuable. And I do see that Dr. Gonzalez is on this call, Janice Gonzalez, who heads the Center for, Janice, can you tell us the name of your center? I'm sorry, it's hard. Are you able to put it in the chat, or what is the center's name?
Healthy and Safe Communities.
Healthy and Safe Communities. And I was just mentioning that about asthma, right? And CMS is the most common diagnosis, and CMS providing wonderful medical services. However, our health services don't yet include prevention in so many ways. And families who have somebody who has asthma in them need air purifiers. They need masks. They need a way of monitoring air quality, because it is life-threatening potentially when it's not just the smoke of a fire that's down the street or in the mountains near you. That smoke that comes down from Canada or comes over from Colorado or Arizona or from across, we know also, unfortunately, impacts our own air quality. So we've got to prepare people in our community for what we're experiencing. And I hope we can understand that. So these are the partner organizations. And if American Lung Association, Conservation Voters New Mexico, one of our key environmental partners, their climate and energy advocate, policy director is now Justin Garut, who has a master's in public health. He's awesome, and he's working for an environmental organization. Enrique, thank you and Janice so much for the Health Equity Council being part of this partnership, Healthy Climate New Mexico, the Alliance, New Mexico Voices for Children, the Environmental Public Health Network, and then our faith community, which we know is so important in so much of our work. So Interfaith Power and Light New Mexico is also part of that. So I just want to briefly go over the proposals, the two adaptation resilience proposals, so that if you have any questions about them, I think, some of you have heard about them. The first one is to establish a state climate health program. We have this came out of the Public Infrastructure Task Force, the need for our state to have more than 0.2 FTEs, right? So this would be 6 FTEs. It would be a program that would established in the Center for Health Protection. Ideally, it would include epidemiologists, tribal liaison, health equity specialists, communications, and a medical director. There is real medical expertise in heat and in these other vector-borne illnesses that we need to be preparing for. Who knows anything about dengue fever and even how to protect ourselves from mosquitoes that we now have in Albuquerque that we never had before. So there's significant medical expertise that is needed. It's not something that we've been trained in. And it would also conduct, really high quality surveillance and evaluation of strategies with communication, including we need early warning systems and, of course, culturally appropriate, impactful education, community engagement, training, and technical assistance. And right now, several different state agencies work in this space. We have our Air Quality Control Bureau and NMED. We have some work in MNERD, Energy, Minerals, and Natural Resources. We have DOH doing some different things, including a Beat the Heat program. So that needs coordination. So I want to ask a question again. Has anybody heard of the DOH campaign, Beat the Heat? Raise your hand.
No, we have not. I haven't.
So I hadn't either, really. I mean, I'd barely heard of it. They have, I think, a little more resources this year. But one of the things, when it was brought up in our meeting today, I asked for some information about where is it being shown. And I wanted to find out today if any of our Health Council folks, I mean, you all, if there's a campaign about how to deal with heat, I encourage DOH to make sure that they share it first and foremost and get input, because you guys shouldn't just see it announced, right? You should have a chance to give some input into it along with the health promotion team members. So I hope that's going to happen, Val. And that was part of my strong advocacy. I have met with Marie Velasco. I have Susan Garcia as part of these conversations. And again, Janice Esperanza and the new head of the Linkages and Access to Care Center, Andrea, along with Jeff Lara, really how important it is when there's a campaign, out of one place that those of you who work with communities are it's critical that the health councils and the health promotion teams be involved. So that's the first proposal. It was in the DOH budget that was presented to the governor, but it did not show up in the governor's budget. We just found out. And we would really love, those of us who are at the roundhouses, we talk about what the needs to educate our legislators. Some of you can lobby, some of you educate. I understand that. And the education that climate health is an important area that we need leadership and guidance and surveillance and support from the Department of Health so we can help our communities. And if you have any stories about that, I'd love to hear them. So that's the first proposal. Are there any questions about it? It's kind of pretty straightforward, right? The second proposal on adaptation resilience is to get funding to communities so that they have the resources they need, because Air purifiers aren't free. Cooling systems aren't free. Masks, N95 masks aren't free. And we know that the communities who need it the most, they need some funding so that they could put in a backup generator at a health clinic. They could expand the hours for and the cooling system available at a rec center. I mean, it's amazing how many of our public buildings don't have adequate cooling. So the Extreme Weather Resilience Fund, which last year we asked for 10 million, this year they're asking for 12 million. The goal is to assist local communities in preparing for and responding to these climate threats, right? So that we can either do the planning, set up systems of even a buddy system. It takes coordination. I don't know if any of the health councils have been involved in doing that. Identifying high-risk families and high-risk social isolation is one of the risk factors that puts you at greatest risk of heat. That's true in unhoused populations, but it's true amongst our elderly. And you can imagine amongst some of our families that are isolated. You have a single parent with 3 children, and what do they don't have adequate cooling, and those children who might have high-risk health needs. So the goal of this is to be responsive to local needs, grants up to $1 million, with at least 50% dedicated to small communities. And it could also be used as a match. And we strongly hope that the legislature will consider creating that fund. And love to hear if you have any questions or comments about how a fund like that could benefit your communities. Any projects that you think that you might, want help with? Val?
Sorry, I hate to suck up the air in the room, but what I know to be true, and just this year, once again, with the extreme fires and the heavy rains and the floods thereafter, and the heat waves and the cold fronts, I know that health councils, Lincoln, Socorro, and many others have been instrumental as a partner in emergency response coordination. So there's infrastructural piece here that the Alliance is also including in its advocacy messaging to the governor, to legislators, to state agency partners like Healthcare Authority, DOH, and many others, to look to health councils in that more coordination effort, because health councils know where their communities are. They know where the elders might be who don't have a backup generator in the middle of winter, and maybe only a wood stove, and maybe not even that, and so they have so much intimate knowledge about our community members and where the needs are. And so although that $12 million funding that of course we definitely will get behind and are behind, Shelley, there's a infrastructural piece I think that's equally important to invest in, and that's health councils. So thank you.
Absolutely. They go hand in hand, that the social infrastructure, right, of the health councils is what, would help drive this. And actually I'm not sure what the final bill, that's weird. A message from the AI note taker?
It
That
happens
is
a lot.
weird.
It's fine.
Oh my God. How rude. I'm sorry. It's not quiet in here. Are you all done? What Val just said was really important. So I'm going to put a link in the chat for a sign-on form that signs on your support, your organization's support or individual support for these 2 proposals. And we have, like I said, currently 23 organizations, everything from the Health Equity Council, as you saw, that whole list, to Pueblos, to different groups. And really would love if some health councils who are able to sign on. It's not yet legislation. You're not signing onto a bill. You're saying you're supporting these proposals. And if you could click on that link, I'm going to just take you. Let's see what it, dynamic link not found. That's really weird. Somebody click on it. Did I give you the wrong link?
I got the same message.
Me
You
too.
did.
Me too.
That is totally bizarre.
There might be a little bug. These things, we go through the same thing, jot form, Bolo, to sign letters of support. Sometimes these things have little glitches that we have to work through,
I
unfortunately.
have never had that happen, so I guess I'm joining the club for little glitches.
Once it's ready, just send it over and I'll send it out to everybody.
Yeah, I'll do that. It is ready. I mean, we've had like I said, lots of people fill it out, but that is just really bizarre. Okay, I'll get over it. I'll have you send it out. Just okay. So then I want to talk to you about some of the other climate bills, because obviously adaptation and resilience are critical. And in order to, our mission is to advocate for climate solutions that protect health and promote equity. And many of you have heard 2030, right? When you hear the year 2030, that is it. We heard it back in 2018. We heard it again with all of these international reports. We have between now and 2030 to drastically reduce our greenhouse gas emissions, carbon, methane. That's what we've got. So there are bills that are being put forward by legislative sponsors, in particular, a trio of bills that I want to highlight for you that are being developed by the President Pro Tem of the Senate, Senator Mimi Stewart. And she has declared that she is making climate change her number one priority. She is in a very powerful position as the leader of the Senate, right? Our New Mexico State Senate. And she has developed 3 bills. The first one is called the Clear Horizons Act. And, I love these names, right? What does that mean? The primary focus of the Clear Horizons Act, that would be great to have a weather response team within the health councils. Chica, in some ways, I mean, I don't, is Brenda still with us? I'm just looking. I don't, except for the health. You are great. I'm not quite sure. You're not, oh, there you are, showing on my screen. Because Brenda, you're with a health council that's part of Chica, correct?
Yes.
So do you want to, I mean, Chica, you're dealing with the health, particularly focusing on water. Have you done anything else with the Chica project in terms of the climate change work?
Our council are our previous contractors, and we're between contractors right now. Had done some podcasts around heat and heat exhaustion, but relating the current things to our personal health. We've done some social media around that.
Wow.
And then, of course, saving water, because water is a big issue everywhere. And right now we're looking at notification systems and how people are notified when their water is contaminated, and working on disparity statements around that. That's what the whole group is working on.
Right.
And so it's been sort of a slow project for us. Because it took a lot of research time on the state's the state coordinators' ends to be able to find the information to bring to us.
Yeah. Well, I'm glad that you took some initiative in terms of the podcasts on heat, and I know there are many active social media networks. So, finding out about this Beat the Heat campaign the DOH is doing, and sharing, one thing I'd love to support in any way is to share how health councils can support their communities with, your particular climate and extreme weather challenges. But every community is being impacted, right?
Right.
So,
Right. And so we'll have a podcast come out this spring on PFAS, and we'll have one on home well systems and how to sort of keep them working, because a lot of that is water conservation as well.
Thank you. And I'm hoping maybe somebody from your health council can come to Climate and Health Day, since you all have a little bit of a head start in this. So this is a fact sheet from Senator Stewart, and she's outlining what we've done legislatively to mitigate to reduce greenhouse gas emissions with our 2019 Energy Transition Act. There was an executive order that was put forward here in 2019 by the governor to reduce emissions 45% by 2030 in New Mexico. That is meaningful, right? That would be a huge, meaningful, but it's by executive order. And I know, we've all been learning executive order means when the next governor comes in, they can just wipe that out. So the Clear Horizons, the Clear Horizons Act, which is what she's calling it, is to put into statute what's in that executive order, a 45% reduction in emissions by 2030. And it's something that all the environmental groups, from the New Energy Economy to the Sierra Club to, there's so many different environmental groups, it's kind of dizzying, are getting behind. And I think as health people, public health people, I hope that we will get behind reducing greenhouse gas emissions as a critical part of our work, right? I know, again, that the oil and gas industry is an important economic driver in many of our communities. We're not talking about eliminating all oil and gas production. We're talking about moving towards a just transition so that our communities can breathe and survive. There is actually a physical limit to how much heat a human being can tolerate. And it's scary because some of you probably have experienced heat that go above this in your community, 115 degrees. Anybody experienced conditions greater than 115 degrees in the last couple of years? I think it has happened in New Mexico. It's that's when people start losing their lives. I mean, they can lose their lives earlier as well. I'm just talking about as a human being species, our limits of tolerance. People can die when conditions of 85 degrees, if they're out in the sun, they don't have adequate water, right? Because 85 out in the sun here means like 100 degrees. And if you don't have shade to protect you, and depending upon your own health.
Does
So,
that factor in oh my goodness. I can't say the word now. Humidity. Yes, at all?
That's a great question. I really appreciate you asking it. So humidity has the opposite effect. Humidity is just like solar radiation, meaning there's it's called the heat index, and in many standards for heat, that's what we focus on. The temperature plus humidity, those are the two things. And so, if you are in a highly humid climate and it's 80 degrees, it feels like it's 90, right? And that's what the heat index does. And there's simple ways of measuring the heat index. In New Mexico, we actually have the opposite. We have low humidity usually, right? So many of us are used to conditions of 90, 95 degrees, low humidity. And if you're in the shade, then actually 95 may even be like a little less than 95. You still have to drink, you still have to take care of yourself. But if you're not in the shade, low humidity, but you have solar radiation, and especially at our altitudes, you add between 10 and 15 degrees to that temperature. So just like with high humidity, you are adding essentially 10 to 15 degrees. Well, our solar radiation has the same effect. We also, of course, have indoor workers who are working in high humidity. Think about your dishwashers who don't have cooling in their small kitchens, right? It's scary to think about that. So we do have some humid conditions, but it's humidity. It's why our heat standards, one of the things we're working on, it's a rule, not a legislative piece, is an occupational heat standard. Our heat standard has to address solar radiation. Humidity is less of a concern, except for in the indoor environments. So Senator Mimi Stewart's going to be introducing these 3 bills: Clear Horizons Act, a second bill called Community Benefits, which is going to be again, kind of like the Enchantment Fund, a large fund to use some of our oil and gas revenues for helping communities with just transition, for helping communities with electrification, charging stations, electric vehicle support, with building support for the infrastructure. It's about 7 different existing funds that are going to be covered in that community benefits fund. And then there's a third bill, which is to give state agencies the support they need for enforcement, because you can have all the laws in the books, but if you don't implement them, they don't really mean anything. And we know that in public health very well, right? That we need to have state agencies with enough support to support the infrastructure to do the work. So there's also going to be an electric school bus bill, which we're excited about because electric school buses protect kids' lungs. Margaret, I don't know if your son takes a school bus, but those diesel engines are really, really hard on kids with asthma. Really hard. So electric school buses are a kind of a win-win. Plus, they serve as a backup generator of electricity during blackout times, or they're a great way to download electricity at night and then make that electricity available, especially in the summer, to cool off buildings. So it's called the School Bus Modernization Act. And then the last one, there's a whole bunch of them that I'll mention, is a wonderful bill called this to solarize rural public buildings like schools, fire stations, municipal buildings in rural communities. And, you know, that's a big investment. What the benefits rural communities get, of course, is they're not adding greenhouse gas emissions in their energy they use, but they also get huge savings on their electrical bills. I don't know if any of you have solar in any of your homes. We put solar in, we got a loan 2010. The loan is paid off and we don't have an electrical bill. It's just an unbelievable thing. And the money we were at that time paying for electricity went to pay off the loan. So after 10 years, we have free electricity. It's an incredible thing. And there are a lot of ways right now for people in their community, including low-income people. And there's a number of bills to make it easier for people who are lower income to solarize their homes because they need the most help with their utility bills when they're paying 20% of their income, right, for utilities. Should never be allowed or happen. So hopefully we'll see some good movement in the legislature. Any questions about any of those proposals or our role as public health people in speaking about the need to lower those greenhouse gas emissions and help our communities with their health and well-being now?
I don't see anything in the chat.
Well, shall we move into all kinds of advocacy, right?
Absolutely. Is this my cue just to check in?
That's your cue to kick in.
All right, team. All right. Here, let me, gosh, so much to update. We have 6 minutes. I'll be very succinct. We have some very encouraging news, my dear. Oh, my little thing is out. Very encouraging news, my dear friends. So NMDOH presented at the Legislative Finance Committee on the 9th, December 9th. And there's a recording. We'll be sharing it with you on Monday. An article was issued by the New Mexican the very next day. Why? Because there was an outpour of support from legislators, 5 members, 6 members of the Legislative Finance Committee, petitioning for recurring optimal funding for health councils. Representative Allison, as you all know, our biggest champion for years now. Senator Rodriguez as well, Senator Steinborn, Representative Chatfield, Representative Baca. There were several others that are missing my mind right now, but that was a true testament to the collective advocacy efforts across health councils, the Alliance, and key partners like Shelley and many, many others. And so I want to thank all of you health councils too for the collective effort, particularly around signatures for our petition letter, which we at every LFC meeting, delivered in this recent ones over 600 signatures. So thank you for the work, directly to members of LFC, Senator Munoz, the Office of the Governor, and then of course to Aria and Gina DeBlasey. Gina is now the interim cabinet secretary at DOH. And so this was very encouraging. We are in ongoing conversations with NMDOH to follow up with specific information that Representative Small was the other one that advocated. And members of LFC want to know and further understand about the funding needs for health councils because it ranges, right? And so some of that data I know you've been submitting through your impact report to NMDOH. And as you know, the Alliance issues a comprehensive survey every fall with all of the health councils, including this optimal operating budget. So it's basically trying to capture all things perfect. You had the optimal funding that you need to operate at a higher scale to really, to serve communities at a higher scale. What would that be, right? And this is information that legislators in whether House Appropriations, Senate Finance, across the board, want to understand directly from each and every one of the county and tribal health councils. So it's a little reminder, if you haven't submitted these surveys, please do, because we're going to be extrapolating that data, and we use that data for advocacy efforts leading into and during the legislative session. As we know, our united voices and collective advocacy efforts is more crucial than ever before. We are under the understanding that DOH included the base funding of $644,000, which we're grateful for, but not the $3 million base funding that this one-time allocation for this year. They did include a supplemental. So we want to make sure we do everything we can to include that state funding for health councils in the state budget through DOH recurrently, my friends. And the collective effort and the collective voice in this room and across the state is what is going to help us get there, much like we did this last year, right? For the first time in 13 years, we were able to allocate 3.6, even though it was a one-time funding, but nonetheless, $3.6 million. That is a huge win, a baby step into the right direction, but nonetheless, a huge win. And as a result, we have our health council coordinators positions secure. So we want to make sure we continue to build that sustainability. And back on the survey piece, we have incentivized the survey. So if you submit all 3 surveys, you get a $25 gift card. So that's really important to have your collaboration on that front. And then going into the new year, I have a little slide deck I want to share with you because it's so, I sometimes feel visual aids help us envision things. Where is my visual aid? Oh my gosh, I just had it. Oh, here it is. All right. So let me just say that some of the wins from the interim session, so as you all know, or should know, Representative Thompson is championing a $43 million funding bill. This is also to have the, financial buffer to support incoming tribal health council partnerships with the remaining 9 pueblos and of course our nations. So as of November, we as in Representative Thompson and the funding bill request received endorsements from the Health and Human Services. So we presented in October, we received that endorsement in November. And the same thing, we presented at Indian Affairs in October, and we received the endorsement in November. So those are our big wins that we should really be happy about. And that's a testament to the collective efforts here. I also want to share that we are very much in collaboration with very key advocacy partners. Of course, with Shelley and the Health Climate New Mexico, with the All Pueblo Council of Governors. As recent as this week, Geraldine and I met with the Northern 8 Pueblos who expressed their support through a resolution. We also have the support from the New Mexico Public Health Association, Farm to Table, and New Mexico Counties Association. This has been 3 years going, my friends. And I know all of you, especially the County Health Council, submitted a survey that was requested by the association because they wanted to understand more intimately about your work. And we are now in their legislative priority. And I think, Shelley, you know what that means. That's a huge deal.
I just really want to, it is a huge deal. And I know it took a lot of work, and it's really important that the county support you. They have a lobbyist as well,
Yep.
and a strong presence.
It's been a 3-year process, but here we are. We did it, and we did it because we got to work together with county health councils. So that's a big, big deal. Of course, supporting the AHA funding bill through the AHA Coalition, Alcohol Harms Alleviation. And just as recent as last night, we were in their meeting with Representative Ferrari and other legislators and supporters of the AHA funding bill. And they are including funding for health councils because what we know to be true is that health councils lead local prevention and intervention efforts in and around substance misuse disorders, which alcohol is one of those substances. We also have the support of the New Mexico Voices for Children. We also have the support of our friends Unite Us, their lobbyists, because we do advocacy. So we're leaning into our partners who can do lobbying on our behalf. And I want to acknowledge Enrique Cardiel and the Health Equity Council in Bernalillo and all its members for hosting their health council and legislative meeting on December 3rd, which we attended, and it was well attended by legislators from the Bernalillo in that specific district. Enrique, if you're here, if you want to chime in, anything I missed?
No, I think that was just a great meeting. The staff pulled together to give a good presentation overview of our work. And I know we missed lots of things, but hopefully we cut all the major things. And we've had good feedback from the legislators that attended. It wasn't just the state legislators. We also had representatives from county commission offices, the mayor of Albuquerque, and 2 school board members who were really excited and interested about collaborating with the health council.
Exactly. Thank you, Enrique. And I do recognize, of course, that, you know, curating events, gatherings, a meeting like this takes a lot of time, energy, and attention. And I envision a day where health councils, all health councils, are resourced optimally, where we can together co-host meetings like this and continue to engage our elected officials, both state, county, government, right, to really inform them. I envision a future where health councils and community voices and partners get to meet with our legislators before interim session so that they inform what those legislative priorities are as well, right? And strengthen that effort. And I also wanted to share that I was doing a tally and assessing our success indicators as part of one of our very modest but critical grants through Ancorum. And in doing some of this assessment, I was able to recognize, identify, tally the fact that we have enlisted 43 legislators out of 114 legislators, entirety, representatives and state senators. This does not include the exhaustive enlistment, obviously, with and from county and tribal health councils. We're working on capturing that, but just from the Alliance's efforts for the last 2 years and building on previous, you know, enlistments from before my time with Representative Allison Thompson, Representative Armstrong, Senator Rodriguez. But that is almost 50% enlistment rate, my friends. Shelley and others who've been around for a very long time in the advocacy sector in New Mexico, I don't know, health councils and partners, what are your reflections? I mean, I think this is a pretty significant enlistment rate in such a short time.
You have done just remarkable work collectively,
Yes.
truly.
And we continue to focus on the newly elected legislators as we go into the new session, right? So working with our predecessors to enlist the new elected legislators. And we've been doing this since before the elections on November 4th, but you know, just to give you an update. And there's lots of ways in which health councils have been involved in advocacy efforts through the advocacy trainings in October, through radio interviews featuring health councils through 2-Year Health. Those radio interviews reach over 1.5 million listeners statewide and counting. Anyways, my friends, there's just been so much collective effort. And as you always hear me say, we are stronger together. So whatever way, shape, and form you can be involved in advocacy efforts, please do join us. And so I realize it's 1:06, oh my gosh. I want to stop there and hear from our health councils and partners if any reflections as we wrap up this year and get ready for the next year in the legislative session. Yes, and maybe we're cheering behind muted, but I feel your love through the actions that you're so deeply engaged with. And once again, Sam, if you can share the advocacy webpage, we're so excited for next year and our collective efforts on all these fronts that help us, really empower us to improve together, improve the health and well-being and maintain the safety of our communities as well, especially with climate. And lots of work to do, my friends. And clearly we're not void of expertise, know-how, lived experience, and dedication. We just need the dollars to back up our work. So thank you for your resilience and commitment to this really important work, my friends.
Thank you so much to everybody for joining us today. Thank you to Shelly for sharing all that incredible information and data and having a really engaging presentation. All of this will be sent to you via email and will be in the monthly newsletter. So if you need anything, feel free to reach out. Otherwise, we will see you soon.
Thank you. Thank you all for participating in your time, truly.
Yeah. And know that we're wishing you all a lovely and restorative holiday season and a most blessed new year. Let's make it count, my friends.
Let's work together. Beautiful. Take care.
Thank you.